Did you know that COPD is the third leading cause of death by disease in the United States? Now you might be wondering, what is COPD? Well, COPD, or Chronic Obstructive Pulmonary Disease, is a chronic inflammatory lung condition that obstructs airflow from the lungs. This leads to symptoms like breathing difficulty, coughing, mucus production, and wheezing. It's primarily caused by long-term exposure to irritating gases or particulate matter, with cigarette smoke being the most common culprit. Two conditions that often contribute to COPD are emphysema and chronic bronchitis. Emphysema destroys the air sacs at the end of the smallest air passages in the lungs, while chronic bronchitis inflames the lining of the bronchial tubes. Though COPD is a progressive disease that worsens over time, it is treatable. With proper management, most people with COPD can achieve good symptom control and quality of life, as well as reduced risk of other associated conditions. Understanding COPD is the first step towards managing it effectively. What causes COPD, you might wonder? Well, let's explore some of the main culprits behind this chronic disease. The primary cause of COPD is long-term exposure to irritating gases or particulate matter. The most common of these irritants is cigarette smoke. Whether you're a smoker or frequently exposed to secondhand smoke, your lungs are constantly being bombarded with harmful chemicals. Over time, these chemicals damage your lungs and airways, leading to the development of COPD. But cigarette smoke isn't the only offender. Other irritating gases and particles can also contribute to COPD. For instance, air pollution, whether it's from heavy traffic or industrial emissions, can cause significant lung damage. Similarly, if you're regularly exposed to dust, fumes, and chemicals in your workplace, maybe you're a miner, a construction worker, or a farmer, your risk of developing COPD increases. In addition to these environmental factors, genetics can also play a role in the development of COPD. A rare genetic disorder called alpha-1 antitrypsin deficiency can make some people more susceptible to the disease. This disorder affects the body's ability to produce a protein that protects the lungs from damage. Without enough of this protein, the lungs can become vulnerable to the effects of irritants and inflammation, leading to COPD. It's important to remember that COPD doesn't develop overnight. It's the result of repeated and prolonged exposure to lung irritants. So the more you smoke, or the longer you're exposed to harmful pollutants, the greater your risk of developing COPD. Also, it's worth noting that while COPD is mostly seen in people over the age of 40, it can occur in younger individuals too, especially if they have a history of smoking or are exposed to the risk factors we've discussed. In summary, COPD is primarily caused by long-term exposure to lung irritants, such as cigarette smoke, air pollution, and occupational dusts and chemicals. A lesser-known genetic disorder can also play a part in making some individuals more susceptible to the disease. Now that we know what causes COPD, let's delve into its symptoms. COPD doesn't happen overnight, and its symptoms can be subtle at first. This chronic inflammatory lung disease slowly creeps up on you, often so gradually that you may not notice the warning signs until the disease has made significant progress. Central to the symptoms of COPD are difficulties with breathing. These can range from a feeling of breathlessness during everyday activities, such as climbing the stairs or walking, to a persistent and distressing shortness of breath, even at rest as the disease advances. The second symptom to look out for is a persistent cough. This isn't your average cough that comes and goes with a common cold. This is a cough that sticks around for weeks, even months, often producing a significant amount of mucus or sputum. This sputum can vary in color, from clear to white, yellow, or even green, and its presence is a telltale sign that your lungs are working overtime to clear out the irritants causing the chronic inflammation. Wheezing, a whistling or squeaky sound when you breathe, is another common symptom of COPD. It's caused by narrowed or obstructed airways, making it harder for air to flow in and out as you breathe. But COPD isn't just about the lungs. Many people with COPD experience fatigue, a symptom that is often overlooked but can be debilitating. The simple act of breathing consumes more energy when you have COPD, leaving less energy for other activities. While these are the most common symptoms, they can vary widely in severity among individuals. What might start as a nagging cough or occasional shortness of breath can progress over time into something far more debilitating, affecting every aspect of life. It's also important to remember that COPD is a progressive disease, meaning it gets worse over time, especially without treatment. So if you or someone you know is experiencing any of these symptoms, don't brush them off as just signs of aging or a smoker's cough. They could be indicators of something much more serious. Recognizing these symptoms early is key to seeking timely treatment. The sooner you can get a diagnosis of COPD, the sooner you can start managing the disease and improving your quality of life. COPD is not just a lung disease. It can lead to other serious conditions. Unraveling the web of complications tied to chronic obstructive pulmonary disease, or COPD, it's crucial to understand that this condition does not exist in isolation. It is a domino that can set off a cascade of health issues, some of which can be life-threatening. Let's start by talking about the heart. With COPD, the strain on your lungs can extend to your heart, increasing the risk of heart disease. The extra effort required to breathe can overwork the heart, leading to conditions such as heart failure and heart attacks. Now let's move on to lung cancer. You see, the same factors that cause COPD, like smoking and exposure to harmful pollutants, are also major risk factors for lung cancer. This means that people with COPD have a higher chance of developing lung cancer compared to those without the disease. Next up is the risk of infections. People with COPD have compromised lung function, making them more prone to respiratory infections like pneumonia. These infections can become serious quickly, leading to hospitalization and in some cases can be fatal. Moreover, COPD doesn't just affect physical health, it can also have a significant impact on mental health. The reality of living with a chronic disease can lead to anxiety and depression. It's not just the physical symptoms, but also the psychological burden that makes COPD a challenging condition to live with. And remember, COPD is progressive. This means it tends to get worse over time, especially if not managed effectively. The damage to the lungs and the subsequent risks don't happen overnight. It's a slow burn, a gradual decline that can span years or even decades. But here's the silver lining. While these risks may sound daunting, they are not inevitable. With proper management and treatment, one can control the symptoms of COPD, slow down its progression, and significantly reduce the risks of associated conditions. The risks are real, but with proper management, a person with COPD can lead a quality life. It's about understanding the risks, taking the right steps to mitigate them, and living life on your own terms, even with COPD. COPD is progressive, but it's treatable. It's a phrase that brings hope and guidance to those living with this condition. The management and treatment of COPD focus predominantly on relieving symptoms, improving overall health quality, and slowing the progression of the disease. First, let's talk about regular checkups. These are crucial in managing COPD. Regular visits to your healthcare provider allow for ongoing assessment of your condition, adjustment of treatments if needed, and early detection of any potential complications. Next, we have medication. There's a variety of drugs available that can help reduce COPD symptoms, prevent flare-ups, and improve exercise tolerance. For example, bronchodilators help relax the muscles around the airways, making breathing easier. Inhaled steroids can reduce airway inflammation, while antibiotics can be used to combat bacterial infections that could exacerbate COPD. Of course, the specific medication plan will depend on your individual needs and the severity of your COPD. Now let's talk about lifestyle changes. Smoking cessation is the most essential step in treating COPD. If you've been a smoker, it's never too late to quit. It's the only way to stop the disease from worsening. Regular exercise can also help by strengthening the muscles that aid breathing, and a healthy diet can provide the energy needed to breathe properly. Pulmonary rehabilitation is another effective method. This is a program that combines education, exercise training, nutrition advice, and counseling. It's designed to help you learn about your condition, carry out your daily activities with less difficulty, and stay active. In some cases, oxygen therapy or surgery may be recommended. Oxygen therapy can help those with severe COPD who have low levels of oxygen in their blood, while surgery might be an option for those who haven't benefited sufficiently from medications. Managing COPD requires diligence and discipline, but it's a battle that can be won. Remember, you're not alone in this journey. There's a whole community of healthcare providers, caregivers, and fellow patients who are there to support you every step of the way. Let's recap what we've learned about COPD today. Chronic Obstructive Pulmonary Disease, or COPD, is a chronic inflammatory lung condition that obstructs airflow from the lungs. The two primary contributors to COPD are emphysema and chronic bronchitis, often occurring together with varying severity among individuals. The main cause is long-term exposure to irritating gases or particulate matter, most commonly cigarette smoke. Symptoms include breathing difficulty, coughing, mucus production, and wheezing. It's important to remember that individuals with COPD are at an increased risk of developing heart disease, lung cancer, and other health conditions. Despite COPD being a progressive disease that worsens over time, it can be managed effectively. With proper treatment, most people with COPD can achieve good symptom control, improved quality of life, and reduced risk of other associated conditions. Remember, early detection and effective management of COPD can significantly improve quality of life. Stay informed, stay healthy.